Hi. Well, there's more news. I think there's been more news in this past 2 weeks than there's been all of last year on Medicare. So this is April 9th, 2018, and there was an article that was published on Friday, April 6th by Bloomberg, and I just found out about it this morning. We'll have a link for it up there in the show notes for you, but the article is "A Rare Loss for U.S. Pharma Lobby Will Cost the Industry Billions." And here's what's going on. So, Congress passed the budget deal just a few weeks ago, and there's a part in it in section 53.116. The article says it's 118 words, and what it says is that lawmakers are changing a Medicare rule, putting manufacturers on the hook for more of seniors' prescription drugs. With translation, it's making manufacturers pay more for for people that are under the Medicare Part D prescription drug plan. And what's happening is right now, when a person enters the coverage gap, sometimes it's called donut hole, coverage gap, both words mean the same thing. Currently, according to Medicare, and I'll put a link up to Medicare's official wording as well, in 2018, Medicare will pay 56% of the price for generic drugs. Medicare in this case actually means the manufacturers will pay 50% of the price for generic drugs during the coverage gap. You will pay the remaining 44% of the price. Now, what's happening here is as a result of the original Affordable Care Act, Medicare has very little to do with the Affordable Care Act, but one of the things it did do one of the things the Affordable Care Act did do for Medicare is it reduced the costs of some drugs in the coverage gap over a period of time. And by the year 2020, that cost was going to drop for generic drugs until to 25%, according to Medicare. In the year 2020. Now, what's happening is that this rule is actually kind of shortening that, so I think as early as next year, the article is not clear, manufacturers are going to reduce the price of prescription drugs to where instead of you paying 50%, around 50% of the cost of the drugs next year, you're only paying 25% of the cost of generic drugs. So that is an improvement for you. Now, that means the full retail cost and everything is still going towards the coverage gap and everything, and you're still, nothing's changed on that when you enter the coverage gap and all that. But the amount that you're going to pay when you're in that coverage gap is now 25%. Keep in mind, 12 years ago, when this whole thing began, when Medicare Part D began, and I was doing this before Medicare Part D, so lest you think that the government actually doesn't do anything good in health insurance, keep in mind that when I first started doing this before 2006, if you needed expensive prescription drugs, there was almost nothing that was going to be able to help you. So adding a portion of Medicare to help with prescription drug costs has been a godsend to a great many people. But then when it started from about 2006 to 2012, when you entered that coverage gap or donut hole, if you entered that donut hole, you would go to a point where you would pay 100% of the cost of those drugs. And then since some changes in the Affordable Care Act kicked in, that has slowly been coming down to where drug manufacturers and other agencies have been paying down the cost of those drugs, so you're not paying 100%. And what this rule is doing is it's sped up the time in which you're going to receive that discount. So beginning next, well, I don't know, the article's not clear, but I'm going to assume it's 2019, you are going to wind up paying 30% of the cost of those generic drugs. So that is according to Bloomberg. So that is a significant discount. Now, the article links to this, and I kind of want to mention it because it's relevant. This comes on the heels of a tracking poll that came out last month in March 2018 by Kaiser Health. And I just want to kind of go over a little bit of the results of that so that you can see kind of how one led to the other. In March, the Kaiser Health tracking poll found that more than a year into President Trump's presidency, half of the public, 52%, and I'll put this graph up, says passing legislation to bring down the price of prescription drugs should be a top priority for both the president and Congress. So a little bit over half. Yet less than half of the public, approximately 39%, say that they are confident that President Trump and his administration will be able to deliver on the promise that Americans will pay less for prescription drugs than they pay now. What that means is that Congress and the president basically got a warning that they don't believe that the public doesn't have faith that they're going to be able to do things to bring these costs down. So Congress and the president did something to bring these costs down. They basically sped up the time in which you're going to get a discount. So those costs are coming down shortly. Pharmaceutical companies rank among the top organizations that the public, including Democrats, Republicans, and Independents, say has too much influence in Washington. 7 in 10 say pharmaceutical companies have too much influence. However, again, this is one of those things, going back to the title of the Bloomberg article, a rare loss for U.S. pharma lobby. So despite the kind of influence that it is perceived the pharmaceutical industry has on Washington, the public did still win out in this case by getting those costs brought down. Now, the last thing I wanted to bring up from this study, because it did have a couple of really interesting things, and again, I think this is relevant because it went to inform the public perception that Congress acted on to try to help show that Congress is actually doing and working to get these costs down. By the way, both sides, it doesn't matter, Republican, Democrat. This is a senior issue. This is a Medicare issue, and both sides came to the table on this one. This part of the article was 8 in 10 say prescription drug costs are unreasonable. Excuse me, and I will put up the graph for this as well. Large majorities of the public say that President Trump, as well as the Democrats and Republicans in Congress, are not doing enough to bring the cost of prescription drugs down. About 8 in 10 say Republicans in Congress, 83%, and Democrats in Congress, 82%, are not doing enough, and 77% say the same about President Trump and his administration to bring down the cost of prescription drugs. So that's pretty much, in my opinion, and apparently Bloomberg's opinion too, since they're the one who linked to this, say that this part in the budget deal, these 118 words to bring down the cost of your generic drugs next year in the donut hole, are a result of public perception. So, talking to Congress really does help a lot of times. And I just wanted you to know. So there is going to be a bit of a reduction in terms of prescription drug costs for people that do enter the donut hole coming soon. Again, the article is not specific on when. My opinion is it's going to be the start of the next year, but it could be a little bit earlier than that, since this is a rule that was passed by the legislature. So that's it. If you want to find out how this affects you, ask a qualified insurance agent. If you are living in Ohio, West Virginia, or Kentucky, feel free to give us a call. We'll be happy to do that, as take a look at any other aspect of your Medicare-related health insurance that you feel needs a little bit of a looking into. With that, feel free to like, subscribe, comment, share our videos, share our site, and we will be back soon. Hopefully not tomorrow. Hopefully there'll be a little bit of time before the next bit of Medicare news comes, good or bad, and we will report on it as best we can as to how it affects you.